Hey everybody, it's back again with doing our series of low back pain through this week. So this is going to be number 3. If you haven't seen the first 2 episodes, go and check them out. I'm just trying to give an idea of what the different causes of low back pain are, what they feel like. Maybe you can see what you're dealing with and see what you can possibly do about it. So today, talking about sprains and strains. That's getting into the soft tissue injuries. So there's a lot of things that we can do with that too. With the sprain strain, the area effect is going to be across the lower back, wherever the injury is, and then also can radiate into the buttocks, down the legs. There's a lot of different radiating patterns for sprains and strains. So there's nothing real specific that says if it's here, this is what you're dealing with. This is kind of a different thing in that way. So these things are typically worse with moving. Any bending, lifting, twisting, anything where you're actually using those muscles to move, when you use that aggravated muscle, that sprained tissue, you're going to get some pain with it. Typically it gets better with rest, but the more you rest it, if you rest for a long period of time, then it can start to stiffen up on you. So some light activity can be kind of good. Getting off your feet and taking frequent breaks is a good way to do it. So then with treatment options here in the office, kind of the same as the last couple of days. Chiropractic adjustments, because when there's a soft tissue injury, there's typically some type of a joint component with it also. So the adjustments can help out. We go fairly light because you don't want to aggravate that tissue. Other things, muscle stem therapy, acupuncture, and cold laser, all really good options to speed that tissue healing up. And then again, stretching and strengthening exercises. You want to go pretty easy on the stretching at first. You don't want to do a lot of real tough strengthening type things. You want to ease into those types of things and then gradually get into doing more stuff as you get better and better. So the expectations in this really varies. It depends on the extent of the damage, how long it's been going on. We usually expect within that, again, that week to 2 range, we want to see some improvement. It may not be getting to where it's perfect a lot of the time. It'll take that tissue time to heal and recover. But over the course of 2 to 4 weeks, should be rehabbed pretty good and feeling and pretty good, decent. And once you're doing a lot of things at home to help yourself on top of what we can do in here, and then spacing treatments out and seeing it less and less. So that's just a general overview of a sprain strain low back area. We'll be doing tomorrow, I believe, is talking about disc herniations, and that's a real common topic. A lot of people think that when they have back pain, they have a disc herniation, a blown disc, a slipped disc. There's a million different ways to word that. And I'll go into the different types of disc herniations tomorrow. So we'll do that tomorrow. Until then, stay healthy.